I lost my grandmother Miriam to breast cancer 5 years ago. She fought long and hard and managed to defeat the disease once before. However, it came a second time and that attack was much stronger. It started off as plain breast cancer and managed to go to her lungs and her brain and ended up taking her life. Knowing if someone may have in situ or invasive cancer requires getting a yearly checkup and being hypervigilant with your own body. These are things that I cannot stress enough, especially for me because this horrible disease runs in my family. There are two distinct versions of breast cancer, in situ and invasive. In situ can be described as a precursor to breast cancer. Ductal carcinoma in situ is when abnormal cells replace the normal cells of the breast ducts and causes them to expand. The American Cancer Society states that this accounts for 83% of in situ cases in America. This is a precursor to invasive cancer and can turn into invasive cancer if the tumor is not seen in time and continues to grow. Lobular carcinoma in situ looks like cells growing in within the breast. There are 5 stages of invasive cancers, stage 0 being the in situ, and stage 1 being the earliest stage of invasive cancer, and stage 5 being the most advanced disease. Breast cancer has up to 21 histological subtypes and 4 different molecular subtypes, each having different treatments, outcomes, and risk factors. Getting checked yearly can definitely help catch invasive cancers at an early stage. There are no gender lines. Both men and women can be affected by breast cancer. The American Cancer Society even estimates that 1% of men can get breast cancer. Men are usually diagnosed at high stage of breast cancer because they're not sure that they even can get it, so they don't get checked regularly. 1 in 8 women have lifetime risks of becoming a person with breast cancer. Getting checked yearly can help catch it at an early stage. Women or men with a first-degree relative in their family with breast cancer are at an increased risk of their own to get it. The American Cancer Society even states that if you have more than one family member, your risk is even higher. And an example of this is your mother or your sister. Having a history of breast cancer makes a person 1.5% more likely to develop breast cancer themselves again. This is what happened to my grandmother. She had it once before and thought that she had beat this disease, but it came a second time and much more vigorous. Starting at age 45, it is recommended by the American Cancer Society that women go to regular screenings. During these screenings, you're going to be exposed to a mammography. During a mammography, it is a low-dose X-ray procedure that allows visualization of the internal structure of the breast. Being hypervigilant with your body is another key factor in catching any invasive cancers at an early stage. Look in the mirror to see any changes in your breasts or your underarms. I say underarms because you can have swelling or even lumps develop there, and that is also an indication of breast cancer. It commonly starts off as a painless lump but can escalate quickly into a painful disease. It can cause breast pain or even heaviness, and those are also factors that happen. Swelling, thickening, and redness of the breast are also indications of breast cancer. Nipple abnormalities such as spontaneous bleeding is definitely abnormal and should be seen by a doctor immediately. The American Cancer Society states that women who exercise regularly have a 10 to 25% chance lower risk of getting breast cancer. Here are images of things that are abnormal in your breast and should be seen by a doctor if any of these are happening to your breasts. October is widely known as Breast Cancer Awareness Month. This speech coincides perfectly with that. Being aware of breast cancer and how important it is to catch it at an early stage can help save many lives. Knowing the differences between in situ and invasive cancers, making sure to get checked yearly, and looking after your body of any changes can definitely help to bring awareness to this harmful disease. Thank you.